And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Welcome to Open Connection, your host, Robert Pictou. Our show today comes to you from the traditional and unceded territory of the Tsimshian people. Originally from Delta, BC, she moved to Kitimat in 2011 and soon began her career in public service as a municipal councillor from 2014 to 2018. She stepped away from local politics to run federally as a Conservative candidate for the Skeena-Bulkley Valley riding in 2019 and 2021 federal elections. Despite garnering most votes in Kitimat in both elections, she finished second overall to the NDP's Taylor Bachrach each time. On today's Open Connection, BC Conservative Party candidate for Skeena riding, Claire Rattee.
My life changed a lot after I moved up here. I came to Kitimat just after I had finished going to treatment for my drug addiction, and I wanted to start a new life for myself, and so I moved up here, bought a house, opened a business, and yeah, I've been here ever since, and it was really the beginning of my life as I know it now.
It's not really just that one thing. There were several factors that kind of come into play when it comes to drug addiction. Is that right?
Absolutely. Yeah, your mental health plays a huge role in it for sure. Also a certain amount of personality type, I suppose. I'm definitely somebody that has a habit forming personality type, I guess you could say. And so, there was a number of different things that happened in my life that I ended up turning in that direction. And it's one of those things that I think makes me a stronger person today and able to do what I'm doing now, because I am very habit forming for sure. And so when I put my mind to something, I will stick with it. And so I've kind of utilized that experience and turned it into something positive.
You were able to shed this addiction and put it at bay, and then say, I'm going to start living life. So you bought a house, you started a business, but then you go, wait a minute, I want to start giving back to my community. Is that when you decided to enter into, I guess, the political field?
Basically, after I'd moved up here, I started getting involved in different things in the community, just, being newer to the community and trying to give back a little bit, because I'm really grateful for all the people that supported me during that time in my life and the people that have supported my business. And so I started getting involved more in the community, and I knew that we had a municipal election coming up. I was 20 at the time and didn't know a lot about what I was getting myself into, but I decided to take a stab at it and run for city council. And I'm really glad that I did. Those 4 years were incredibly informative, very valuable for me, and taught me a lot about being involved in politics at a municipal level. And I started learning more about, provincial and federal politics, and that's how I decided to continue on that path. I just really am passionate about giving back to this community, and I think also because I come from the Lower Mainland, after moving up here, I realized a lot of the things that we don't get access to up here, and some of the ways in which we are overlooked by the provincial and federal government. And I wanted to do something to change that and bring awareness to our area and make sure that we get, the equity of services that we deserve.
The North is an economic driver for BC, if not a lot of Canada, because you're right there in Kitimat and you're seeing all kinds of things happening in that small little district.
Absolutely. Yeah, no, it's definitely, things have been changing a lot here over the last 13 years that I've been here, and we definitely are an economic driver, and it's important that we get investment back into our communities, and that it's paid attention to, because we have provided so much economically to the rest of the province and the rest of the country, and we are often overlooked for a lot of services, and I'd like to see that change.
No, one of those things that you mentioned earlier is that you were fortunate enough to be able to go into a treatment center, because you go, hey, I have a issue that I need help with, and you were able to get services with that. But here in the North, that's not necessarily the same. Is that right?
That's correct. Unfortunately, that was one of the biggest areas that I saw that was being overlooked, was around mental health and addictions supports, treatment facilities, detox facilities. In Terrace right now, we have the second highest rate of overdoses in the province, second only to the downtown east side. And yet the closest accessible treatment facility is in Prince George. So it's, up to 8 hours away for people in this region. And that's just not acceptable. On top of that, we know that Indigenous populations are disproportionately affected by addictions issues, and they make up 3.3% of the population in this province, and yet they account for 14.7% of the overdose deaths. And so it's very disproportionate. In my opinion, it's cruel that we don't have access to those types of facilities. And yes, as you said, I was really lucky to have access to that when I lived in the Lower Mainland. But unfortunately, a lot of the people suffering in our area right now don't have that access. And I think that needs to change immediately.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Thank you for staying with us. In Canada, much of the existing evidence on health disparities experienced by people who use drugs comes from research conducted in the downtown East Side neighborhood of Vancouver. Evidence from prospective studies shows that people who identify as Indigenous are less likely to receive treatment for substance use, and if they do access treatment, they're more likely to drop out. Let us return to the conversation as Claire highlights an Indigenous organization looking to make a difference.
The Northern First Nations Alliance that is looking at this treatment facility, and my understanding is, as of right now, they have been able to find land and buildings, but they're still struggling with the funding. The provincial government, after a lot of convincing, has come forward with some funding for them, but it's still not enough. So yeah, my understanding is they have to get nonprofit status to access the funding. And as I said previously, it's still not enough money to be able to build the facility out the way that it needs to be done. But I am really happy to see that they're taking the initiative on that they're looking at, ensuring that it's going to be land-based healing, that there's going to be wraparound care that's associated with that. And I think that's another area in which the provincial government has fallen short right now, is the wraparound services that we are also needing, whether it's mental health supports, education, life skills, housing. There's so many different aspects. And right now, they need the funding. They need help with the funding, because I think that they are more than capable of building out this facility and doing it in a culturally appropriate way and ensuring that there is, equitable access to all people in this region. But the funding is necessary, and that's where I feel that the provincial government has dropped the ball. They've had 7 years to be able to approach this challenge and tackle it, and they've made essentially no progress. The only thing that we've really seen is a lot of focus on harm reduction services, and the whole purpose behind harm reduction is it's supposed to be somewhat of a stopgap, right? It's keep people alive long enough that you can get them to treatment, that you can get them well. And when there is no treatment facility, when there is no secondary step, when there is no harm prevention aspect to it, then where do people go from there? They just stay high, and that's not acceptable.
There usually is an underlying issue, usually when it comes to mental health illness. Do you feel that Skeena has the resources available to help those people journey back into society?
Currently, no, I don't think that we do. That being said, there is a lot of great work that is being done around providing those mental health supports. And there's a lot of different community partners that have worked very hard at that, but we still don't have enough. We still don't have all of the facilities that we need and all of the services that we need to be able to access for that. And it's a hugely important part of somebody getting on the path to recovery. There's a lot of focus right now, it seems, with this current provincial government on potentially funding detox facilities, and my understanding is this money that they have earmarked for this project is specifically for detox. And detox in of itself is not enough, because if you put somebody through detox and you get them to the point where they're physically not dependent on the drug anymore, they are still in the same mental space that they were when they went in there. They're still not healed mentally. They still have not had the help that they need, specifically, on a spiritual level, which is why I think the land-based healing is so important, because you need to be healed spiritually as well. And so if you release people out of detox, and it's the same problem that they're facing in other areas like the Lower Mainland, in the sense that often, the two facilities are separate facilities. You go to detox first, then you're released and you're put on a wait list for a treatment center. And what happens in most cases is that people are released. They know they have to wait, sometimes it's days, weeks, months before they're going to get into this treatment facility. Often they'll go out and use again. And now they have no tolerance to the drug, which is a big part of the reason why we're seeing so many overdoses. So that in of itself is not enough. These need to be wraparound services. We need to ensure that, we have equal number of beds from detox to treatment, and ensuring that those further services are provided to people after they have left the treatment facility, to ensure that they stay on that path to recovery and that they're supported until they feel healed.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Welcome back to Open Connection. Earlier this month, in separate news releases, Interior Health Authority announced that 100 Mile District, Nicola Valley, Lillooet, Caribou Memorial, and South Okanagan hospitals all temporarily paused emergency department services due to limited physician availability. Let us return to the conversation with Claire.
I think that it's a huge oversight. It's amazing that we're getting the new hospital. It's desperately needed, but we already don't have enough staff to staff the current hospitals. We're constantly seeing ER closures and diversions going on from all of the kind of, perimeter hospitals like Kitimat. And it's frustrating. We're one of the only jurisdictions that still hasn't hired back healthcare professionals after the pandemic. That would be one of the very first steps that I think needs to be taken, is we have healthcare professionals that are available to work in these fields. We need to hire them back. We need to ensure that more of our funding is direct funding to the front lines. Many of our nurses right now are essentially working as administrators. They're so bogged down by paperwork and bureaucracy and red tape, and it's just insanity, rather than actually delivering the services to people on the front lines as they were intended to do, which was their goal in getting into this profession. So we need to make sure that we can end those ER closures, that we can hire back the nurses. At the end of the day, we're spending more than 11% of our GDP right now on healthcare. That's more than 27 other comparable countries. So it's a very large amount of money that we're spending on healthcare, and yet we're ranking among the lowest as far as outcomes when it comes to other comparable OECD countries. So obviously our healthcare system is not working right now, and we need to have a major overhaul on how we're approaching things. And hopefully we're able to hire those nurses back, encourage and incentivize more nurses and more healthcare professionals up here to the north. That is part of our plan, is looking at northern and rural remote communities to ensure that we can maintain the staffing levels that we need. I'm hearing this constantly when I'm meeting with other nurses, paramedics. It doesn't matter what aspect of that frontline work. They're overwhelmed, they're stressed out, there's not enough people to handle everything. The nurses right now, the BC Nurses Union has their Ratios Saves Lives campaign, because we need to have ratios of staff to patients to ensure that people are getting the proper care that they need. And a scary thing that not a lot of people are talking about right now is that there are a comparable number of people dying in this province that are on wait lists for diagnostic services and surgeries and things of that nature, as we have dying of the opioid pandemic. So it's frustrating, to say the least, that healthcare has gotten to this state in this province. But I think that we need a really strong plan to be able to fix the issues at hand. It's not going to be quick. It's going to take time.
You brought up the pandemic that had happened, and the NDP government at that time made a decision that to not allow those healthcare professionals who decided not to be inoculated, that they could no longer practice their profession. Do you hope to see that the Conservative government, if they do get elected, that will come in and actually kind of take that restriction off so those healthcare providers can rejoin the workforce?
Yes, we are committed to repealing, I believe it's Bill C-36, and ensuring that those healthcare providers are reinstated. And again, I think we're one of the only jurisdictions left that hasn't done that yet. So I think it's an incredible oversight, and it's a big part of the reason why our healthcare system is falling so far behind.
Now, just recently, there was a farewell dinner for the outgoing MLA, Ellis Ross, and one of the speakers that spoke that evening was a local First Nations elected official, and he mentioned that forestry was, in essence, the birth of the economy here in the North. Do you agree with that?
I do. I think forestry is a really important component of, being an economic driver for us up here. And I think that the forestry sector in general has been completely decimated over the last couple of years. And it's really sad that that's not been a focus for this provincial government. We have started coming out with our plan around forestry, and I think it's going to make a significant difference in our riding specifically. We're looking at replacing the stumpage with a value-added end product tax, and encouraging industry to get more value out of and jobs out of each of these logs. It'll result in higher value products, better utilization of the fiber. Also, around both forestry and the energy sector in general, we're looking at implementing a one project, one permit process, because it's going to reduce costs for all of the parties. It's going to encourage more viability of investment. And that's a really important part of, making sure that we can be global players here, and that we can ensure that we're looking at the most value-added product that we can. And it's really important for us up here in the North, because a lot of our jobs depend on that.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Calling for a reform to facilitate faster approvals, improve communication among stakeholders, and make BC's forest sector more attractive to investors. In this final segment of Open Connection, Claire shares about the one project, one permit policy.
I think that that's a really important part of our economy here. I think that small businesses are the backbone of any economy. And it's important that we're encouraging that and incentivizing that, and specifically within First Nations, because it provides a lot of economic opportunity for people that are living within those First Nations.
Now, of course, one of the other big projects happening in First Nations community is a little further north in the Nisga'a territory, and they're looking at getting this LNG or this natural gas pipeline going, but they're kind of running into a couple of hiccups here and there. Do you feel that if you're elected that you'll be able to help streamline that so the economic opportunities will be available here in the North?
Absolutely. I think that comes back to part of this, one project, one permit process. And it's frustrating to see what they're facing right now in the NAS, because they have the approvals in place, they've done their environmental assessments, and ENGOs are coming in and blockading things and really adding a lot of tension within the communities. And it's frustrating because the NDP is essentially silent. It doesn't seem that they've been doing anything on that. It's hardly been reported on, and they're saying they want to respect rights and title, and they've got a First Nation that is trying to provide economic opportunity for their people, and they should be stepping in and doing something about this. They've got neighbors pitted against neighbors, and we've seen what happens with this already. This kind of stuff needs to end, and the government needs to step in when necessary to ensure that these projects can actually go forward, because that's what it seems most people are looking for in that area. And a couple of ENGOs that send people out from other areas of the province shouldn't be allowed to try and block projects like that.
Now, of course, there's one thing about being said about having these projects and these opportunities here in the North happen, but we really need to make sure that we hire local, and that's only going to happen because of education. What is your thoughts on that?
Yeah, I think that there needs to be a lot more focus being put on education and training opportunities. There's a lot of community partners right now that have been doing an excellent job of that in this region, but there certainly always needs to be more. when it comes to training in the trades and all of that sort of stuff, so that we can ensure that these projects are viable, that we can keep locals employed there. It's going to reduce a lot of the strain that gets put on our local infrastructures. We've seen what that looks like already in Kitimat through the modernization at Rio Tinto, and now through the building of LNG. It would be great if we could see more local people getting hired into those positions. We don't have the ECs trained up here. We don't have the facilities built out to be able to provide childcare. It's a really big struggle for many of the people living in our region, is that we don't have access to childcare. It's a really big barrier for a lot of women getting back into the workforce, which is really frustrating. We've got a project right now in Kitimat with TAMTIC status of women. They're building out a phenomenal project where they're working on having low-income housing, shelter for women and children, they're going to have offices for TAMTIC status women in there, but they're also building in a level for daycare, and they're going to also build a level for daycare and start encouraging women that are utilizing that shelter and things like that to become early childhood educators and get them trained in that field, so that they are now able to re-enter the workforce, working with children, providing, filling those gaps that we have to be able to provide more childcare. And my understanding is right now that it's supposed to be the first 24-hour childcare center that we'll have in the north here, which would be phenomenal for a lot of people that work shift work.
We have LNG Canada and we have Rio Tinto. Do you think it's time for organizations to step up and say, hey, we employ most of the people here in the north, let's fully take care of them as family and start incorporating childcare into these workplaces?
I think it certainly could be a good avenue to look at. My personal feelings are that typically when government gets involved, they tend not to do the greatest job. So private enterprise tends to be more successful in those areas. I think that a big part of the problem is, again, just the lack of people that are qualified to be able to run those sorts of facilities. So again, coming back to the education piece and training, it would be great to see more government programs incentivizing people to be trained in those areas, so that they can then go and work in private sector of being able to provide childcare.
Writing that we don't have an incumbent coming in. So we have new candidates that are vying for this position as MLA. Are you looking forward to the upcoming debates with your opponent?
I am, yeah. I think it's going to be a really good opportunity for people to be able to hear our ideas, have some healthy debate and discussion around, our different viewpoints and what our parties are looking at doing. We are going to have one in Kitimat that's going to be on September 25th at the Mount Elizabeth Theatre, and one in Terrace on September 26th at the Terrace Sportsplex. And I think they're both going to be really great opportunities for people to be able to hear our voices and understand, a bit more about our platform, and to ask some questions. There will be questions from the floor allowed as well, which I think is great, just so that if anybody has a burning question that they want to hear answered by both of the candidates, they get that opportunity.
Thank you for joining us for this episode of One Point Connection. The greatest distance in the existence of man is not from here to there, but that connects from his mind and heart. If we can conquer that distance, we can soar like an eagle and realize our immensity within. I'm Robert Pictou.